Hi, it's Tom here from Running Physio. Today I want to talk to you about how you can select running shoes for specific running injuries. And we'll talk through some examples here, shoe selection for patellofemoral pain, for calf and Achilles issues, also for forefoot and great toe issues, and tibialis anterior issues as well. So hopefully give you some ideas that you can use in clinic. If you'd like to know more about shoe selection for your runners, because it is a big topic, we have a whole module devoted to it in Running Repairs Online, one of our 18 separate modules that we have to help you master running injuries. So do check out the link for that, find out more about the online course and how it can help you. Now, I want to start this video with a little bit of a disclaimer, a word of caution really when it comes to shoe selection for running injuries. I think we need to be aware that this is an area that's a little bit of a gamble. It's rolling the dice a little bit when it comes to selecting shoes for specific individuals and specific injuries. And that's because the individual response to different shoes is really very variable and unpredictable. So we can't know for sure if we put someone in a specific shoe that we're going to get a specific and very obvious reaction in terms of symptoms or reducing load. There isn't also a great deal of evidence in this. There aren't many studies that have taken runners with pain, tried a different type of shoe, and actually shown that that significantly reduces symptoms. We also know that when we try to use shoes or other methods like gait retraining to reduce load on one area, there's a downside. It tends to increase the load elsewhere. So for example, if we take someone out of a shoe with a large heel to toe drop, so they've got a large difference between the heel stack and the toe area, so they're essentially resting in a slightly plantar flex position. If we take them out of that shoe into a more minimalist shoe, it's likely to increase the load on the calf and Achilles. So we always have to be bearing in mind the trade-off that we're going to have when we recommend a different shoe and whether increasing the load elsewhere is going to irritate certain tissues. So that's something else to bear in mind. We also know that rapid transition to different types of shoes, to minimalist footwear, for example, is associated with an increased injury risk. In some studies, up to around 80% of participants getting injured. So it's a bit of a gamble. There's a little bit of a risk here. So we need to bear that in mind. But shoes may actually, for some people, be a simple way to alter the load on sensitive tissues, perhaps reduce the load on areas that are sore, and they may help to facilitate certain gait changes, which may also reduce the load and be beneficial for that individual. So don't think we want to write them off altogether, but if we use them, we need to use them fairly cautiously and sensibly and think about each individual. I'd also suggest for most of our runners, shoe selection is not your first priority. Lots of runners might think it's all about the shoes, but actually I think the priorities lie around education to help the runner understand their injury, load management to get the training at the right level, and exercise prescription to address any deficits in things like strength, control, and flexibility. So I get those things in place first and then see where we might be in terms of which shoes may benefit a runner. So let's reason through how we might do this with a specific injury then. A runner comes into you with some pain. What we'd be hoping to try and do is choose a shoe that may actually reduce the stress on the sensitive tissue. And we'd be testing that with each individual runner by seeing if their symptoms are any less when they're running in that shoe. We may also want to test it to see if it changes their running gait. So why not get them to bring in a couple of pairs of shoes to a session and assess their running gait in those different shoes to see how they influence their running gait pattern and whether that leads to some advantages that might reduce stress for that particular person. For example, as we'll talk about in a moment with patellofemoral pain, more minimalist shoes can encourage us to run with a slightly increased step rate. And that can help to address overstriding, which can help with patellofemoral pain. But that might be something we want to test because not every runner, when you give them a minimalist shoe, will respond in that way. It's very individual. So why not test it out? Why not see if it actually does help that runner in clinic, whether it changes their running mechanics and whether that then ultimately leads to some reduction in their symptoms. So let's talk through some examples here then. Now, I will say with each of these are largely theoretical in terms of how we might reduce the load on the tissue. Not many of these things have been studied, so please don't see these as set in stone. So first up, if you've got a runner with tibialis anterior pain, what's often known as ABOS or anterior biomechanical overload syndrome, we think this is related to fatigue of tibialis anterior. So one of our goals here is to reduce the demand on the dorsiflexors, to reduce the work for tibialis anterior. Now we may do this by reducing the shoe weight or mass, so that it's a lighter shoe that tibialis anterior has to lift into dorsiflexion towards that later swing phase of the running gait cycle. We might encourage a lower heel to toe drop because this might help the person to land in a less dorsiflex position. So again, less work for tibialis anterior. So as an example, we may move towards a more minimalist shoe, because that's likely to have less shoe weight, a lower heel to toe drop. And in terms of the gait changes, it might encourage the person to move towards more of a midfoot strike, which again means less demand on tibialis anterior when they land. So hopefully this different shoe type might reduce the stress on that area and help with pain. But ultimately you'd want to test it in clinic. But there's always a trade-off here. Switching straight from a very supportive, structured shoe to something very minimalist is likely to increase the stress on the foot, calf, and Achilles and increase the risk of injury there. So if you were going to go down this route, you'd want to go for a slow transition, or it might be appropriate for someone with tibialis anterior symptoms who hasn't been able to run for a while or just finds running in their normal shoes very provocative. So we might be restarting the return to running process in a new shoe type, in which case there's less of a worry about transition, providing we're gradually increasing what they're doing and we're making sure we're not getting symptoms elsewhere. So that might be the approach for someone with tibialis anterior symptoms, alongside obviously education and load management. What about calf, Achilles, and possibly tibialis posterior issues? Well, here we want to reduce the load on the calf complex. We may also want to reduce peak ankle dorsiflexion. Now, this is particularly important for tibialis posterior and insertional Achilles tendon issues, where we think there's going to be more provocative load on the tendon when we're loading in deep dorsiflex positions. So this is really the opposite strategy from tibialis anterior. We may actually want a moderate to large heel to toe drop to help prevent them going into such deep dorsiflex positions. It might be helpful to have quite a cushioned heel cup, that heel cup region around the heel, around the back of the shoe, because if you've got insertional Achilles pain, a very firm heel cup can press on that sensitive tendon and make it really quite sore. And actually some motion control features may assist in tibialis posterior tendinopathy. And there's a theory too that some of these features, like a large heel to toe drop, some motion control features, may actually be helpful in medial tibial stress syndrome too, may reduce some of the stress on the medial tibia. What we might want to avoid in this group would be minimalist shoes or shoes with very firm heel cups that are going to press on that sensitive heel region and irritate it there. But of course, bear in mind there's a trade-off. Shoes with a larger heel to toe drop are probably more likely to increase the stress around the knee region. So we've got a few options there that we could try with calf, Achilles and tib post options. Next up, thinking about patellofemoral pain. Now here our goal is to try and reduce patellofemoral joint stress. So here actually we probably do want a lower heel to toe drop, possibly less support as well, because there is that trade-off. Large heel to toe drop may mean more stress for some runners on the patellofemoral joint. Now there's some nice research in this. Bonacci et al.'s study in 2018. They found that switching to minimalist shoes actually reduced patellofemoral joint stress by about 15% at the runner's preferred cadence. And this reduction in patellofemoral joint stress was higher, around 29%, when these minimalist shoes were combined with an increase in cadence, so a 10% increase in step rate. So this really is providing some evidence that switching to more minimalist footwear may help people to up their cadence, and in doing so, reduce patellofemoral joint stress. But we see in this study an increase in cadence alone was sufficient to reduce patellofemoral joint stress by 16%. So it might be actually that we don't need to switch to those minimalist shoes to get those benefits, that we could just try a small increase in cadence, typically around about 5 to 10%. And this is something that I would think across the shoe selection spectrum here. What are the other options available to us? Are there simpler options that are going to be just as effective, if not more effective, that we can try? And does switching this runner to a minimalist shoe, does it actually change their running gait pattern? Because for some it won't. They'll continue to heel strike and overstride in this new shoe, and it won't necessarily be achieving what you want it to. Okay, finally on our example is thinking about someone with maybe great toe pain, metatarsalgia, possibly Morton's neuroma. Here we would want to reduce the load on the forefoot and typically reduce toe extension, because that's often thought to aggravate great toe issues and can aggravate metatarsalgia and Morton's neuroma. So with these runners, we probably want quite a firm sole, particularly in the forefoot, to reduce forefoot bending. So they're going into less extension across the toes. We might want a wide toe box, so there's not compression coming sort of laterally onto the foot and irritating the forefoot region, and a good fit. So we don't want a shoe that's too small and again could be putting pressure on that region. Now, there's some debate here around heel to toe drop, but I would suspect maybe low to moderate would be appropriate. If they're in a very high drop, that might lead to slightly more extension across the toes. And a rocker shoe might be an option for this group to help to reduce the stress on the forefoot as well. And here we're probably thinking minimalist or very flexible shoes, possibly even just old shoes that have lost their rigidity, may be more likely to aggravate. So I'll often have a look at someone's shoes and see, if they're old, can you kind of curl them up into a bit of a ball? Have they lost their rigidity? In which case that might be time for them to think about getting new shoes. So a few options there for you to think about in terms of shoe selection for some specific injuries. As we said, we're going to do this cautiously. We want to be careful here that we don't sort of put all our eggs in that basket. And first of all, we get the priority treatments in place around education, load management, and appropriate exercise selection. And when we're coming to selecting shoes, for me, it's more about reducing load on sensitive tissue. It's more about seeing if we can achieve specific goals for that runner than it is about correcting any fault, such as pronation. Pronation is not in any way a faulty movement. It's a normal part of our running gait cycle. So I'd prefer to work with an individual and think, what is my goal for shoe selection here? Is it to reduce the stress on sensitive tissue and therefore reduce pain? Well, let's test that goal. Let's see if during some running with us on the treadmill, perhaps, it actually reduces some of their symptoms during that run, or whether their pain kicks in later during a run. So let's test that theory out. If our goal is to change the running gait pattern, perhaps to facilitate an increase in cadence and addressing overstride, well, let's test that out too. Let's get them on, in a session, do a gait analysis and look at the influence of running shoes on that person's gait. So it's more about asking, does it achieve these specific goals, and trying to ensure it does so without irritating other tissues. So something to bear in mind with it. But first of all, get those other priorities in place and bear in mind that it is a bit of a gamble. You're rolling the dice a little bit with shoe selection. There's also been a good question that gets asked around this. Would you actually advise a runner to go and buy new shoes? Because then there's a cost involved in it. I think ideally you work with the shoes that a runner has to find what's most comfortable for them. And we had a nice example of that recently with someone who had insertional Achilles tendinopathy. And the main running shoes they had were either a trail shoe that was very flat and had quite a firm heel, or they had a more cushioned shoe, actually an Asics Gel Nimbus, which has more of a heel to toe drop. Now, with them, they actually said running in the trail shoe with the lower drop and the firmer heel was much more uncomfortable. They could feel that firm heel section pushing on their Achilles insertion, whereas running in the Gel Nimbus, much more comfortable for them, much more cushioning around that heel section. And really, that's a really good example of when just some simple advice over which of their shoes to select can be really helpful. If you want to advise someone to buy new shoes, that's a little bit more tricky. But if you're going to go down that route and they're happy to try it, the best thing to do is to try those shoes out in the running store. A lot of running stores these days have treadmills or give the option to try the shoe and see how it feels on their foot. See how it feels in terms of symptoms, and then if it feels more comfortable for them in terms of symptoms and it feels comfortable to run in, they may well want to choose that shoe. Our final thought on this, when we're making these changes, be cautious with big changes. If you're changing someone from a very structured shoe with a large heel to toe drop down to something very minimal, that is a bigger change. So you may look to make a smaller change. You may look to move them to something just slightly less supportive initially. Or if you're going to advise a big change, make sure that transition is gradual. Okay, thanks very much for listening. Hope you found this helpful. If you'd like to learn more about shoe selection and the science behind it, the role things like pronation plays, how you can assess foot and ankle movement during running gait, and the anatomy of a running shoe, do check out Running Repairs online. I've put a link for it there. We've got 18 great modules for you to learn all about running injury and help you get great results in clinic. Okay, thanks again for listening. Bye for now.